Welcome to our YouTube channel. This channel is meant to talk about lifestyle activities. Today, we are going to discuss stress, what it is about, and how you and I are supposed to solve some of the triggers. I have with me Dr. Isaac Newman Arthur, who is a medical doctor and clinical health psychologist and acting director of the University of Professional Studies Medical Directorate. Doctor, welcome.
Thank you very much.
I hope everything is fine.
Well, I'm fine. I hope you're also fine.
No, I'm also fine.
Are you sure you're fine?
I'm doing very, very well.
Okay.
I think my viewers are very grateful that we've gotten you here today. We are very grateful.
Thank you.
Thank you. So today we are going to discuss what stress is. A lot of students go through a lot of activities that put them under serious conditions that affect them. Research shows that about 70% of students complain or report of depression and anxiety due to some of the activities that they go through, exercise, examinations, and parental pressures. When we talk about stress in general, what is it?
Okay, so thank you very much for your channel. I think you're dedicating the channel to students and helping them and all that. I think that is great. So I want to encourage you to do that. And I hope that everybody who watches this video will share so that a lot of students would get to listen to some of these important topics. When we say stress is basically a response to demands, and those demands usually are overwhelming demands, and the demands can be internal demands or external demands. And I would say that stress is one of the mental health problems. So stress is not just some issues of life, but it is part of mental health problems. So it's a health problem. Anytime someone feels stressed, it's a very, very common term people use. They should understand that they are going through a health problem. The same way someone has malaria or hypertension or diabetes or things like that. It is also a health problem, but it is under mental health. So the response to internal or external demands, and those demands usually are overwhelming, and they are persistent, and sometimes may be there for a short duration or a long duration. So those demands, the external demands may be, like you mentioned earlier on, the academic issues, relationship problems, financial issues. It can be their businesses that they may be running alongside. It can be stress of looking for accommodation, commuting.
That is very prevalent. Right now, we just came to campus and a lot of people are stranded. Yesterday, there were issues on campus.
Yes, trying to even patch people, dealing with friends and what they do, relationship issues, having to live with new people in a hostel, and all the problems that come with it. What do you call it? If you're a female, stresses of being a female, the pressures from people, your own menstrual cycle and the problems with your menstrual cycle, and the pain during menses, and all that consistently throughout the semester or throughout the year.
I have a friend who he recently keeps on postponing things, even assignments. She or he has 2 weeks to complete the assignment, but he will wait just few hours before the assignment, then he'll be rushing. And even with that, he has to postpone it 10 minutes before deadline. That's when he'll be rushing. Now, he doesn't study like he used to be. He's not of himself anymore. That one, can stress contribute to that?
Yeah, well, I think that that gentleman, we need to be able to evaluate everything that is happening around him. There may be multiple problems. Sometimes, even right from childhood, how parents have handled him, his current problems. So obviously, this guy is going through a lot. And maybe he may not even acknowledge it. It's possible he's even having some influences from friends here and there. And because of that, his focus in terms of academic has been shifted to other things which may not be too important. So I think that it may be under some form of stress from various places, but we may have to have some interaction with this person to find out what exactly is happening with him, so that he can be helped. Because obviously this is not normal. You know, and there are things probably maybe going through. Some may even be addicted to some things. You know, and addiction is a big problem on campus. You know, people use addictions to cope with problems. You know, so he may even have those who are addicted to things. You know, they can't focus on their academics.
I actually advise him to see the University of Ghana counseling department.
No, so UPSA has a counseling unit. So is he?
Yeah, he's in University
of Ghana.
But
so
he didn't want to go because of stigmatization.
Well,
so
he can come to UPSA. We have a wellness unit. Yes, so you know, generally students don't want to go to their own place because of stigma, like you talked about. But he can come. UPSA has a very, very good system.
So now, what are the things that you, as students, you are supposed to do to reduce some of these stresses?
Well, there are various ways that we suggest when it comes to stress management. The first step is for you to acknowledge that you are going through some stress. You need to come to the point to realize that whatever is happening to me is because I'm stressed. That acknowledgement is so important. Because if you don't know that whatever you are going through is stress, you may not be able to take the right decisions to be able to deal with that. 2, you need to be able to identify what your stresses are, the triggers are. Why am I stressed? What are the things that is a stressor to me? Or what is stressing me? You need to be able to clearly define the stresses so that you can be able to take some particular steps to be able to deal with those stresses, right? And so if you identify, maybe it's the financial problems, or it's the way I'm studying, or it's my own way of thinking about things, or it's the health problem, or it's the financial issues, then you are actually on your way to fixing it. Because if you don't know that you have a problem, you cannot fix that problem. So those evaluations has to be done. Then again, you'd have to realize that stress is a health issue. And if you are overly overwhelmed, you walk into any health facility. University of Professional Studies, we have a clinic, we have a wellness unit, we have counselors in the counseling department. You know, they have been trained. We have psychologists, we have counseling psychologists, we have counselors, we have all kinds of people who can help you. So sometimes you just have to walk to see any of those professionals to seek help. Because sometimes trying to fix the problems yourself, you may think you can, but you need a professional perspective as to how to fix it. Then when you see the professional, they would be able to teach you some things we call self-help skills. You know, they may also help you develop some healthy practices that will help reduce your stresses. Right? There are things we'll teach you about stress management that will help you. Some of the things, maybe I'll mention them, is first have a positive attitude towards life. Evaluate everything in a positive way. So for example, exam is coming. The person who says, hey, this exam will be difficult, I don't think I'll pass. The person will feel, this person will feel more stressed because of that. And anytime you evaluate an event negatively, or anytime you face a stressor, the body actually responds by releasing all kinds of stress hormones. And those stress hormones and chemicals, right? You have the cortisols, you have the epinephrine, norepinephrine, and those things. They affect your blood pressure, they affect your pulse, your respiration rate, they affect glucose control, they affect your immunity and all that. So those who are stressed, they're always sick, they're always...
So stress brings different health conditions into the body.
Yes, very soon you have hypertension, diabetes, those things, right? So it is important. So the moment you evaluate an event, the body goes into that kind of state, right? But the moment you begin to evaluate things in a positive way, you are kind of bringing the body back to normalcy, right? So someone says, another person will say, oh, exams are coming, no problem. Even if it's difficult, I'll do my best.
Self-motivation.
Even if I fail, I'll write again, I'll move on. That person is likely to feel less stressed. And that is why we may have two students. One person seems not to be affected by things, Another person seems to be overwhelmed.
It's not that he doesn't bother himself with the exams or something.
But they have a certain perception about life, and that keeps them.
Mentality.
So, for example, you don't have money. One person will say, God, why me? Why is that all the time I'm struggling? Is that how life is going to be for life? I don't think even life is even important. I don't think I'll make it in life. That is a very negative way of approaching things. You always feel sad and overwhelmed. Another person who doesn't have money will say, Charlie, cash no day, but Charlie, it will be. Even if Charlie, I have to, fast sometimes, I will do it, I will make it. Today I don't have money, but tomorrow I know I'm going to be rich. Or the person will say, Charlie, how can I make money? How can I make money? Charlie, on campus, maybe I'll sell this, that. Some people may even decide to even sell toffees. Ever far. Someone even decide to sell toffees in class. By the time, he goes back home, person may have some 2 cities or 3 cities or 5 cities profit. So that person has a positive outlook towards life. So they are likely to feel there's a stressor, but the impact of the stressor is minimized when you have a positive attitude towards life. When I was on campus then, almost every exam I slept in the exam room. Because I had the mindset that if, for example, there are 5 questions, you go into exam when there are 5 questions, and they say answer 4, you've answered 2. The rest of the 3 questions you don't know, you didn't study. You have 2 options: either to sit down and cry and still not change the questions, or sleep. Either way, you will not solve the question. And I had the man said that the exams will not determines a person's future. Do your best. If it doesn't go well, try again. And that's so a positive outlook towards life. That's a lot of things. The next is what we call positive self-statements. Positive self-statements. In Christianity, we say confessions, right? Where you speak to yourself. So you wake up in the morning, you look in the mirror and you talk to yourself. I've got this. I'm going to do well. I am pretty. I'm handsome. My future is bright. I'm going to do it. You imagine in the morning you are going to write an exam. So you talk to yourself. These exams I'm going to do well. Even if I don't do well, I will succeed. Nothing will stop me. So you go into the exams with some kind of motivation. It's just like footballers who are going to play football and they motivate themselves in the dressing room, or soldiers, they are going to war and they shout and they scream. See, there's something that happens to you when you actually talk to yourself. If you are going to any of those problems, you may have to speak to whichever authorities are involved to be able to help you, deal with those problems. Then if you have family-related problems, keep family issues at home, and focus on your life. If you're on campus, you are not the one responsible for your parents or your siblings. You're responsible for yourself. Some people, your parents must be parents. You are not supposed to be working and sending money home when you're a student. That's not the time. So don't carry family problems. The reason why they keep coming to you is because anytime they come, they knock, you open the door. Learn to say no to relatives. You are just a student. Focus on your life. Otherwise, you fail all your exams and end up like some of your relatives who are not making it in life. And that is why a lot of students are failing by carrying people they shouldn't be carrying along. Unless, of course, maybe you have 1 or 2 siblings and their parents are not around. Maybe they are dead or something, and for some reason you have to be the caregiver. Then you have their dead responsibility. But apart from that, as far as they are alive, you are not supposed to be sending money home, sending money this. And a lot of students who are taking care of parents, no. It's just not appropriate. If your parents are fighting and they want to divorce, leave them. Focus on your life. Leave them. If your parents are not neglecting and all that, if they are failed, you don't fail yourself. Because a lot of students are carrying family problems into the home, and it's really affecting them. And anytime you realize you're overwhelmed, please seek help.
So we are discussing stresses, the triggers, and how to overcome them. I am speaking with medical doctor and also a clinical health psychologist and acting director of the University of Professional Studies Medical Directorate, Dr. Isaac Newman Arthur. So, Doc, you're going to talk about nutrition. some of the foods that help
well,
reduce
yeah,
stress?
generally normal, most of our day-to-day foods helps, local foods and stuff helps. And so if you're a student, at least once in a day, maybe some banana fruits helps. You know, most of the fruits you like, so maybe banana, orange, those things, pineapple, it can be your diet.
Dr. Isaac Newman, time will not permit us. Would have loved to continue the conversation, but we will be ending here. Doc, your last words.
Well, stress is a health issue, and anytime you are stressed, see it as you are unwell. It's a health issue. Walk into any health facility, you will find help there. But UPSA has an amazing health facility, and we are
I can see the environment is very serene.
Yes, and so you can also walk in, and it will help you.
Thank you. We just discussed stress, what it is about, and some of the triggers and how to cope with it. I did it with Dr. Isaac Newman Arthur, the Director of University of Professional Studies Medical Directorate, and also he's a clinical psychologist. If you have any problem that you think you want to see him, we have his contact over there. Just pick it over there. You can also get our social media handles. You contact us, we will get to you so that you speak to him over there. Can you like, share, and subscribe to this channel? We have a lot of content coming up. Thank you. God bless you. Bye bye.